In part 3, we're going to look at measurements, growth charts, documents and lab results, as well as outgoing consultations. First, we'll start off with measurements. As I mentioned in the last one, all the patients are going to come in with their height, weight, and head circumference percentiles needing to be done. The staff at the front will do height and weight and entered into a growth chart. They'll either start a growth chart for new patients or continue one on for existing patients. The only thing the resident will have to do is do a head circumference and enter it in. The way that you can enter it in here is the little plus mark for measurements, and then you hit PEDS, and you'll see here that there's different values. You can do a GP. Often the staff will write yes or no, and in the comment section write who they are, so it'll say yes. And Dr. Johnson, and so on down the line. And then height, weight, everything like that will go in, and you press submit. And not only will it show up in the growth chart, it'll also show up in the chart at the bottom here where the mouse is. And then when you come in, you'll hit measurements and go through and hit PEDS, and then you're going to enter the head circumference. So when you submit that, again, it's going to go down here, but it's also going to show up in the growth chart right here. Under eForms, there will be a growth chart started. We'll click on it, you'll be able to see, and you'll be able to see where it's plotted. Of course, these aren't actual realistic ones because they're a fake patient with fake figures, but this is how it'll be plotted. The next part I'll show you is where our lab results are, and that's under documents or lab results. And you can see here on the left-hand side is where there's documents. That's stuff that doesn't come through under Accelerus. That stuff will be X-rays, consult reports, other lab reports. They'll be named appropriately, and these ones you can just see a test. If you open it up, it'll take you to whatever the document is. And if you go to lab results, we don't have any here because this patient doesn't have a PHN, but ones that are coming through Accelerus will be listed under lab results. And again, that'll largely be stuff that is only people that have blood work or some consults from some hospitals, who's ever on Accelerus right now. The last thing we're going to talk about here is consultations. This is outgoing consultations. So if you're referring a child to another specialist, you're going to click on the plus here. And it's going to take you to this consultation request. There's only a few items that you're going to need here. You're going to need the service. So if you're going to do allergy PEDS, you're going to click on the consultant. If you're not sure which consultant or which service to hit, you can always ask the physician or another resident. There's also ones that aren't specific up here that are medical genetics. So not all of it is to a specific doctor. There's some programs at hospitals in here. The other thing you're going to need to write is the reason for consultation, which is down here. You're going to write a reason. There's pertinent clinical information, significant current medications, allergies, etc. You don't need to fill all those out. Just fill it under reason for consultation. Again, when you're done, you're always going to want to put, like I said, R1 for Dr. Winters or whoever you're working with for that day. It's really important for you to do. The last thing you can do for this is you can attach a file to the consultation. If you wanted blood work or such to go, you could click on the file, you click on the results that are available, click on it, done, and then you're going to submit consultation request. Once you submit it, that's going to go to our front staff, and our front staff will take care of it from there, whether it's faxed out, whether we call for the referral and appointment time, or anything like that.